Today's webinar will cover how to track and manage lab cases by using Nextech's Labs Needing Attention feature. It's basically Nextech's Labs Tracker, and as you'll see in this video, when used properly, this feature is a big time saver because it eliminates time-consuming paperwork and instead creates powerful automation of our lab management process. This allows us to more accurately track our lab cases and ensures that patients are contacted about their results in a timely fashion. And although the tracking and management of labs is a combined effort by the provider and the medical assistant, this video is intended for medical assistants, and so it will demonstrate only the workflows that apply to MA lab responsibilities. That said, there are three main workflows you will learn in watching this video. First, how to view your open lab cases and track their progress. How to mark labs as completed. And lastly, how to view lab results and then document that you informed the patient. Let's begin with the first workflow, how to view open lab cases and track their progress. You'll first need to open to any patient's account and enter the Labs tab. Now that you're in the Labs tab, you'll see the Labs Needing Attention button, and clicking on it displays a new window with a list of all open lab cases in the system. As you can see, there are many of them, so it may take just a moment to load. Now, the labs in this list can be filtered based on ordering provider, the lab procedure, or the lab step. And it is recommended to filter this list to make it much easier for you to find what you're looking for. For example, instead of looking at all of the open labs in the system, I can select the specific provider and only look at his or her labs. Let's select Dr. Kelly Poole from the list, and you'll notice that there are 3 open lab cases for her. Now, in this test scenario, there are only 3 labs, but in a real scenario, you'll likely have several open cases filling up this entire screen. And that's when using the other 2 filters, the lab procedure or the lab step, can be very helpful. But we'll come back to those later. I first want to call your attention to the list of labs down here, because this is not just a list of open labs, it's also a summary of each lab that shows us very helpful information about each case. And it's a big time saver because we don't have to leave this screen to look at the results report for the same information. So you'll notice that it shows us the name of the patient, and that column is actually hidden on my screen, so I'm just going to open it up. There we go. We see the patient's name, the ordering provider, the date the lab was created, the anatomic location, like for a biopsy, or the test ordered, like for blood work. We see the receiving laboratory and other information like the results flag, the initial diagnosis, the final diagnosis, and the lab step. We'll come back and review the results flag and the lab step in more detail later in this video. But what I'd like to show you now is that you can actually sort your list of labs based on any of these columns. And it is recommended that you sort by the lab date. So you'll click on the title of that column right here where it says date. And what that will do is reorganize your list of labs so that the oldest lab is now showing at the top of your list, and the most recent lab is now showing at the bottom of your list. And again, this is very helpful when you have many labs for the provider. It makes it much easier to find what you're looking for. Now that you understand how to view your list of open labs, let's discuss how to track the progress of each lab. And this is where the lab steps play an important role. When a lab is created, a tracking ladder is created along with it, listing the steps the lab must take before it is considered complete. And all of our labs have 4 steps to completion, and they're the same 4 steps for each type of lab. So it's very important that you understand the steps and what they mean. So we'll review them together now. So let's select our biopsy lab procedures. And you'll notice how now my list is suddenly showing me my biopsy cases. But let's call your attention to the lab step, and you'll see that there are 4 steps to completion for a biopsy. Again, these are going to be the same 4 steps for your culture labs and your lab work. So step number 1 is results pending. And when a lab is at this step, it means that the results are not yet available. Now, when the results come into Nextech, this step is automatically marked as complete by the system, and the lab progresses to the second step, which is biopsy ready for review. When a lab is at this step, it means that the results are now available and that the provider must review the result and sign it. The provider does that electronically in Nextech, and once they sign the result, the system automatically marks this step complete, and the lab progresses to the next step. And the next step is inform patient of results. When a lab is at this step, it means that the provider has signed the result and the patient must now be informed. Now, Nextech can't know when you speak to a patient, so the person calling the patient with the results must manually mark the step as complete. And I'll show you how to do that later in the video. Now, once the step is manually marked as completed, the lab will progress to the next step, and that's the final step, pending treatment. When the lab is at this step, it means that the patient needs to return to the office for further treatment. For example, in the case of a biopsy result that came back with a malignancy and now requires the patient to return to the office for an excision. Now, Nextech can't know when we treat a patient. Therefore, this step must be manually marked as complete as well. And once you do that, the entire lab will be complete and no longer trackable on this list of open labs. So the main points to remember here when we're talking about our lab steps is that in order for a lab case to be considered complete, all 4 lab steps must be satisfied. The first 3 steps will automatically be marked as complete by the system. when certain actions are taken. But the final two steps, inform patient of results and pending treatment, must be manually marked as complete by you or by the provider. Brings us to the second workflow you will learn today, and that's how to mark labs as completed. And as I mentioned before, lab tracking is a combined effort by the medical assistant and the provider. And as medical assistants, you are responsible for tracking two of the four lab steps. The first are lab cases at the step pending results. And you'll want to do this in order to audit for any results that may have been delayed and require some investigation or follow-up with the lab. So looking at our list, I can select to see my biopsy cases at the step results pending. And you'll notice that I have no biopsy cases that I'm waiting on results for. So I can then look at my cultures at the results pending step, and I see the same, no cultures for which I'm waiting on results. And finally, I can look at my lab work at the results pending step. And I do have one case that has not been resulted, and this was ordered on April 21st. So this is definitely a case where I would do some investigation. Knowing that the receiving lab is LabCorp, I would log on to the LabCorp web portal and see if perhaps the result is available there. And if it is not, then I would call the lab directly to do some further investigation as to what caused the delay. Now, as a medical assistant, you are also responsible for tracking the cases at the step inform patient of results. And you'll do this so that you know which patients you're required to call, helping the providers ensure that patients are notified of their results in a timely manner. So looking at our list, we can start with our biopsy cases and look at the step inform patient of results. And I see that there is one case that has been resulted and that I need to call in to a patient. Now, before you make that call, please refer to the result flag column. And you'll want to do this because as a company, our policy is that medical assistants inform patients of results only when that result is benign. Therefore, the providers will actually flag the cases that they would like for you to call in. And the case is flagged as benign result, MA to call patient, like you see right here. You'll know that this is a call for you to make. Now, this is a very important piece of this workflow because unfortunately, if you do overlook this step in the process, you could potentially be calling the wrong patient. Now, let's say we went ahead and called this patient and made contact and delivered the results. We now need to mark that the step inform patient of results has been completed. And in order to do that, remember, this is a step we have to manually mark as completed. Nextech cannot possibly know when we call a patient. So in order to do that, we'll have to enter the patient's chart. And we can do that by clicking on the name of the patient right from this list. Now I'm in the patient's chart within the Labs tab, and I'll simply look for the lab in question, which happens to be the only lab showing for this patient. And you'll notice that you have the requisition number and other identifying information about this lab to help you make sure you're looking at the right one. There could be multiple in a real live scenario. Now, below the requisition number, I see the steps for this lab. And you'll notice that the steps that were already completed have the box checked and are highlighted in green. Because I just called the patient, made contact, and delivered the results, I can go ahead and check that inform patient of results has been completed. Please make sure that you are only checking this step as complete if you did successfully deliver the results. If you, on the other hand, got the patient's voicemail, or perhaps there was no answer, please do not mark that the step was completed. You'll just need to try again on a different day. And once you do make contact with that patient, you can go ahead and mark the step complete. Now, because the result was benign and there is no further treatment required, I can also go ahead and mark the pending treatment step as completed. And now that all 4 steps have been satisfied, I can mark my entire lab as completed by checking this box next to the requisition number. Nextech will then ask if I wish to mark the entire lab complete, and I'll say yes. And you'll notice that the steps are hidden now and the entire lab is highlighted in green with the box checked to signify that it is now a completed or closed lab. And something else that will happen is that this lab, which is now closed or completed, is no longer trackable within my labs needing attentions list. Remember that this list is only tracking your open labs. So now that we have marked our lab as completed, let's return to our patient account. And I'd like to show you the final workflow, which is how to document that you've informed the patient of results. And I'd also like to show you how to view the original pathology report, as you may need access to it from time to time. So first, let's open to the NextEMR tab to create a note and document our conversation with the patient. Now, if you have an iPad, documenting on it is the recommended workflow. It's much more efficient. I don't have mine today, so I'm going to complete my note right on the computer. So I'll open a patient message note and begin to write my message. I spoke to patient regarding lab results, and now to document the call details. There's my note, and now I'm going to sign it. Again, this is much more efficient on the iPad. And now I'm going to close my note. My note is complete, and that's the end of your workflow. Before we end the video, though, I'd like to show you how to access the original pathology report. And you can do this by simply right-clicking on the desired lab and selecting Open Lab from the menu. And from this screen, you'll notice a magnifying glass right above the pathology report. When you click on that, it zooms it in for you. And you can print this report if needed, or just simply view it. That's the end of our video today. And you should now feel comfortable with the 3 workflows we focused on: how to view your open lab cases and track their progress, how to mark labs as completed, and finally, how to view the original lab result reports and also document when you informed a patient of results. Thank you very much for watching.